Thanksgiving Day 2014, me and my girls went to Jackson, Tennessee to do some Black Friday shopping.
We had got everything we needed and we're in the checkout line. And my mom started saying that she felt like she was having a heart attack. And I was like, no, you're not. No, she was having an anxiety attack. We can just take some medicine when you get home. And we got in the truck and she put the heat all the way on and rolled down the windows, and we got home and we stayed up a little bit because she started feeling a little better. We watched some TV and then we finally decided we were going to go to bed.
I get up because my other daughter here had to go to school. I had to go to work, so I got up with her because I like to tell her, goodbye in the mornings. And I think it just went to heck in a handbasket, I guess you could say. I went back to bed. I got up. My husband decided he was going to go get the deer and take it to have it processed, but I didn't want to go because I was too tired. And then from what he tells me, he turned around and he said I was not doing anything.
I'd asked Ashley to call 911 because I realized something was going on. She was having trouble breathing, and I went over to her. She finally went out, quit breathing and everything. I got her down in the floor, and that's when I started the CPR until the EMS got there. When the EMS arrived on the scene, I happened to know one of the drivers, and I hollered at him and said, "Billy, get in here now." And when he come in, I told him that there was no breathing and there was no pulse. So he hollered back at the other paramedic and told him to bring a defibrillator. And when they got inside, they placed a defibrillator on her and shocked her one time. And when I saw that, I thought it was probably best for me just to get up and leave. And so I walked outside with Ashley. And then they put her in the ambulance, and they got a pulse and everything going again, and they said, that he's going to Jackson General.
We were contacted via EMS concerning a 47-year-old female who had had an out-of-hospital arrest. She had received a shock for ventricular fibrillation while she was at home. She was transferred to our center for further evaluation. Upon arrival here, we noted that the patient had a stable EKG as well as blood pressure. However, she was not responding to us at that time. We then decided to take her to the catheterization lab for further evaluation. In the catheterization lab, she was noted to have triple vessel disease as well as left ventricular systolic dysfunction. The decision was made that she needed to have surgery for her coronary artery disease. We also decided to place her on a cooling protocol to allow her heart to rest.
Dr. Robinson came out and they had determined after the heart cath that she had had a heart attack, and that over the next 24 hours that her body, since it was a witness arrest, that they were going to do the cool down system and that her body was going to go to a hypothermic state.
The hypothermia protocol is a novel technique that allows us to cool the core temperature of the body down to about 34 degrees Celsius. This allows the body and the brain to rest after a traumatic shock to the body. This has been shown to improve outcomes in these patients doing this protocol.
I had the great privilege of sharing in the care of Ms. Vickie Cleek during her stay here at Jackson General Hospital. Her story, where I picked up, involved me taking her to the operating room for coronary bypass surgery. Of course, many events preceded this, the most significant of which was when she had her cardiac arrest at home. Her husband actually performed CPR, and we can attribute essentially her life-saving modalities to that initial CPR event. Vickie is the mother of 2 children, and I'm just privileged to have shared in her care.
The first thing I remember is I woke up Tuesday night. Dr. Robertson was in there telling me it'd probably be 10 days before I could go home. I told him no, I was going home Friday. I had just had my surgery that Monday. But I kept arguing with him. Just kept telling him, I'm going home Friday. That Friday, Dr. Appleby come in, and I told him I wanted to go home. I was ready to go home. He saw no problem. And then little by little that afternoon, that whole afternoon, everybody started releasing me. So I think we left the hospital around 5 o'clock, and I was sitting at my house at 5:30.
We would like to thank the West Tennessee Heart and Vascular Center here at the Jackson-Madison County General Hospital for the excellent care that was provided for Vickie while we were here. All the way from the emergency room to the ICU, to the ICU waiting room, everything here, we sure do appreciate the care that was given to her while our stay was here.